Hi everyone, welcome back. My name is Omatayo and today I want to give us recipes for post-transplant care, recipes for post-kidney transplant care. So if you have had kidney transplants, this is video is for you. If you are looking forward to have kidney transplant procedure, this video is actually for you. Perhaps you just want to have knowledge about post-kidney transplant care, you can actually watch this video as well. And so as we know that kidney transplants restore all the functions of the kidneys, and the benefits of kidney transplant actually outweigh other forms of renal replacement therapy. But then there are some rules, there are some recipes we can actually follow for us to have a great outcome, and of course to have um, longer survival of graft. So there are some recipes that can guide us for us to have a longer graft survival so that the kidneys will not fail. So, like I've stated some recipes here. The number one I have on my notes is that always remember that kidney transplant is not a cure to kidney failure, but just another form of treatment. So we have to actually have this in our mind. So we need to be open to this truth that kidney transplant is just another form of renal replacement therapy. It's just a treatment, although the benefits outweigh others, but then it's not a cure to kidney disease. So we must have this in mind. Then the second point I have is ensure you are psychologically and mentally capable of taking the anti-rejection drugs till the end of life. Newsflash, you need to take these drugs for the rest of your life if you really want to actually keep the kidneys functioning. So you have to take the anti-rejection drugs for this period of for till the end of life so that the kidneys will not be rejected. The new kidney will not stop working. The number three point is that there is need for lifestyle modification. You cannot just be about that because you've had kidney transplants. You can just live your life. You can go to clubs. You can go to parties. You can drink whatever you like. It doesn't work that way. So you need to actually modify your lifestyle so that you will not endanger this new kidney. Then the fourth point I have is never ever reduce your anti-rejection drugs on your own. So your immunosuppressant has to be taken as prescribed. You have no reasons to reduce the dose on your own because if you do this, the new kidney will be rejected, and that would be a waste of resources, waste of precious organ. So please, you have no right to reduce any dose of medication, any dose of immunosuppressants on your own. You have to abide with the prescriptions of your doctor. So the fifth is adhere to your doctor's appointment. So don't skip. If you are to travel, if you are going to be out of town, let your doctor know so that they can do necessary checkups and guide you appropriately. The sixth is say no to herbal concussion, herbal medication. You have no business taking this, as this could be dangerous to the kidney. So, as a post-transplant patient, you have no reason to smoke. You have no reason to drink alcohol or engage yourself in other unhealthy substances. This is not good. So, and the last is that never skip any investigation. So, do everything accordingly, and that's actually the care of post-transplant care actually requires a lot of money, and that is why you need to sit and calculate if you are going to be able to sustain it. So you do that. There are three key things when it comes to post-transplant care. You need to be mentally stable, psychologically stable to take your medication. You have no room to reduce your own immunosuppressants on your own. You never skip any investigations. So these are actually so important when it comes to post-transplant care. And remember that the success of kidney transplant lies on you. In fact, you have about 85% work to make this a success. So if you are looking forward to have kidney transplants, or if you have already had kidney transplants, or perhaps you know someone that is willing to undergo kidney transplants, please let them know these key factors that are important in the post-transplant care. See you in my next video. Bye.